Miscarriage is a common and natural occurrence in human reproduction, often affecting about 10 to 20% of known pregnancies. While it can be emotionally difficult, it's important to understand what happens in the body. In this video, we'll explore the biological processes behind miscarriage, why it happens, and what your body goes through, clearly, step by step. To understand miscarriage, we first need to look at early pregnancy. After fertilization, a tiny embryo travels to the uterus and attaches to its inner lining, called the endometrium. This lining is rich in nutrients and blood vessels, providing the support needed for early development. As the embryo implants, the body begins forming connections that will later become the placenta. The body supports this early stage using hormones. Progesterone helps maintain the uterine lining, keeping it thick and stable so the embryo can stay attached. Estrogen supports blood flow and tissue growth. Together, these hormones create a carefully balanced environment that allows the embryo to grow during the earliest weeks. Miscarriage, also known as spontaneous pregnancy loss, occurs when a pregnancy ends naturally before 20 weeks. Most miscarriages happen in the first trimester. In many cases, this occurs because the embryo cannot develop properly or the body cannot support the pregnancy. Importantly, miscarriage is usually a natural biological event, not something caused by a person's actions. The most common cause of miscarriage is chromosomal abnormalities. Chromosomes carry genetic information, and when there are too many or too few, the embryo cannot develop normally. These changes usually happen by chance during the formation of egg or sperm cells. When this occurs, the body naturally ends the pregnancy because the embryo is not viable. In some cases, the uterine environment or hormone levels may play a role. For example, if the uterine lining is too thin or hormone levels are not sufficient, the embryo may not be able to implant or grow properly. The body may recognize that conditions are not ideal and respond by ending the pregnancy. Early signs of miscarriage can include light spotting or cramping, sometimes similar to a menstrual period. The body begins separating the embryo from the uterine lining, and this process may unfold over hours or days. In some cases, miscarriage happens so early that it goes unnoticed. Although less common, miscarriage can also occur later in pregnancy, during the second trimester. In these cases, different factors may be involved, such as structural differences in the uterus or other biological conditions. The process still involves the body recognizing that the pregnancy cannot continue and naturally expelling the tissue. The immune system also has a role in pregnancy. Normally, it adapts to tolerate the embryo, even though the embryo is genetically distinct. In rare cases, the immune system may respond differently, which can contribute to pregnancy loss. This reflects the complex balance the body maintains during pregnancy. While most miscarriages are due to natural biological causes, certain external factors may slightly increase the risk. These can include infections, significant physical stress, or exposure to harmful substances. However, it's important to remember that most miscarriages are not caused by anything within a person's control. When a miscarriage occurs, the body begins a natural process to remove pregnancy tissue. Hormone levels drop, signaling the uterus to contract. The uterine lining sheds, and tissue passes through the cervix. This is the body's way of returning to its pre-pregnancy state. Not all miscarriages look the same. Some happen very early, even before pregnancy is confirmed. Others involve noticeable symptoms like bleeding or cramping. The experience varies depending on timing and individual biology, which can make miscarriage feel unpredictable. Hormonal changes are a key part of the process. Levels of progesterone and estrogen decrease, which triggers the breakdown of the uterine lining. These changes can also affect mood, energy, and sleep, reflecting the close connection between hormones and the rest of the body. Although this video focuses on biology, it's important to recognize that miscarriage often comes with emotional responses. Feelings like sadness, confusion, or grief are common. Understanding the biological process can help reduce self-blame and provide a clearer perspective on what happened after a miscarriage. The body begins to recover. The uterus gradually returns to its normal size, hormone levels stabilize, and bleeding usually stops within a few weeks. The reproductive system remains capable of future pregnancies, showing the body's resilience. Most miscarriages are isolated events. Experiencing one does not usually mean it will happen again. Recurrent miscarriage is less common and involves different underlying factors. In most cases, the body is able to support future pregnancies successfully. In situations where miscarriages happen more than once, further evaluation may help identify underlying causes. This can include examining genetic factors, hormone levels, or the structure of the uterus. These investigations aim to better understand the biology involved. Miscarriage occurs across all populations and backgrounds. Its frequency highlights that it is a natural part of human reproduction. Understanding this helps reduce stigma and encourages more open, informed conversations. Learning about the science behind miscarriage can be empowering. It allows people to understand their bodies more clearly and reduces feelings of uncertainty or guilt. Knowledge helps replace fear with understanding. Ultimately, miscarriage is a biological process in which the body recognizes that a pregnancy cannot continue. Through complex systems involving hormones, the immune system, and the uterus, the body responds in a natural and protective way. By understanding these processes, we can approach miscarriage with greater clarity, compassion, and respect for the body's complexity. Knowledge helps us move forward with awareness and a deeper understanding of human biology. To enjoy more tips about your health, please like, subscribe, and thank you for watching.